Thank you for joining me today for Medicare 101. My name is Paris, and I'm here to guide you through the basics of Medicare and help you make informed decisions about your health care with the hopes of you allowing me to be your agent. This session is not just about Medicare basics, but also about helping you uncover ways to get the most out of your coverage. Have you ever had a question about Medicare and couldn't get an easy answer? I have. To start, Medicare is a federal health insurance program primarily for people 65 and older, although it covers certain younger individuals with disabilities or specific conditions like end stage renal disease. Medicare is divided into four parts. The main parts are Part A, Part B, and Part D. But you'll see Part C, which we'll go into more detail with, like to call that a combo because it's Medicare Advantage, and it combines Part A and Part B, and usually Part D. So just like building a house, Part A is our hospital insurance. It covers inpatient hospital stays, skilled nursing facilities, hospice, and some home health care. Part B, just working on building that house, is medical insurance. It covers outpatient care, doctor's visits, preventative services, and durable medical equipment. And then let's jump to Part D, then we'll go back to Part C. But Part D is prescription drug coverage, which covers the cost of your prescriptions. And then, like I mentioned, Part C is the Medicare Advantage, which is an alternative to your original Medicare, and it combines all of these parts. So let's get into Part A to start. Let's meet Linda. She's 65, just turned 65, and is applying for Medicare. She qualifies for premium-free Part A because she worked and paid Medicare taxes for over 10 years, which is 40 quarters. Let's dig into a little deeper of what that means. So, to be eligible for Part A, you must be 65 or older, unless you're one of the younger individuals that we mentioned, be a U.S. citizen or legal resident, work 10 plus years, or your spouse did, to get the Part A premium free. Right now, if you or Linda hadn't worked those 10 years, you would have to pay around $505 a month for Part A in 2025. So it's normally free unless you don't have your four quarters. And again, just a reminder for the top part of our house, Part A, that covers inpatient hospital care, skilled nursing facility, hospice care, and limited home health. The cost right now, you can look for hospital deductible, would be $1632 per benefit period. So that would be each time you're admitted into the hospital, which is very similar to coverage that you've had through an employer. This goes through days 1 through 60, the cost, 61 to 90, 91 to 150. And most of you know, if you've had a hospital stay, they're normally not keeping you that long. So right here, we've got Part A taken care of for Linda. Now we'll move into Part B and keep building her healthcare house. For Part B, I have to break this down into two sides because it's a little bit more complicated. This you'll see Robert, who's 68, so he's over the age of 65. A lot of individuals are still working when they turn 65. So this is this scenario. Robert delayed enrolling in Medicare Part B when he turned 65 because he was still working and had employer coverage. Now that he's retired, he's signing up during his special enrollment period to avoid a late penalty. So for Part B, again, you must be 65 or under 65 with a qualifying disability. You must enroll and pay a monthly premium. This is not automatic like Part A. You have special times that you can enroll, special enrollment periods, or general enrollment if delayed. We can go into more details with that with you individually. So Part B is going to cover, again, doctor's visits, outpatient tests and labs, preventative services, your durable medical equipment, some outpatient surgeries. Now here's the cost, and this changes every year. This year it's $185 per month. Now if you have an IRMA, which is a higher income, you would know, you will have a higher premium, and that's all based on your your IRMA. The annual deductible for this year is $257. After that, we'll go into more detail. Medicare pays 80%. Robert or you would pay the 20%. So right here, if we have Part A and Part B, there would be no out-of-pocket maximum unless you fill in that gap with that Part C, that combo advantage plan, or a Medigap. But let's talk a little bit more about Part B that covers the medical services. So this is where it gets really important. You must maintain credible coverage, or this is where you start hearing about all the different penalties that can be placed on you for a lifetime. And that's when you don't enroll into Medicare Part B or keep it properly. Non-enrollment penalty for Medicare Part B is a 10% surcharge for each year you should have enrolled but didn't. A lot of things happen, but the reason does not matter. If you are placed a penalty, it stays with you for a lifetime. Credible coverage is typically through an employer or a spouse's employer. COBRA coverage does not count as credible coverage. If, unlike regular Medicare with COBRA, if you're getting that from the employer, you have 8 months after you separate from the employer in order to enroll in your Part B. So everything is on a timeline. VA health coverage is not considered credible coverage. So to always to make sure when in doubt, ask someone like me and make sure that you are enrolling into your Part B at the right time. So if there's ever a life change, definitely make sure to take on that. So far we have our Part A, our hospital. We went over our Part B. We're building our house. Now let's talk about Part D, and then we'll go into that Part C and the Medigap options as well. Part D. Now this is assessed as its own part since it's a separate part in Medicare. And first, before we go into the scenario, just a little bit more about Part D. It's assessed each month that you don't have credible drug coverage. So unlike Part B, that is assessed annually, this one is per month. Although it's deemed as optional coverage, if you do not maintain credible drug coverage once you're eligible, you'll be assessed the penalty. The penalty is 1% of the national average of drug plan costs. So that's about 33 cents per month, which may not seem like a lot until that's every month for the rest of your life. So the penalty is added to your drug plan costs for the rest of your life. And this doesn't matter if you had an Advantage plan or a standalone drug plan. If you messed up your enrollment or that time, that penalty will still apply. So let's take a look at Sheila. She's a retired pharmacist. She takes several prescriptions to manage her chronic conditions. She chose a standalone Medicare Part D plan to go with her original Medicare and Medigap coverage. So to have Part D, you must be enrolled in Medicare Part A and Part B. Part D is available through a standalone Part D plan. That's if you're considering keeping original Medicare. Or, like we'll talk about in more detail, it can be bundled inside of a Part C Medicare Advantage plan. For Sheila in this example, she enrolled in her initial enrollment period, so she didn't get a penalty. But if she had waited, that's when her penalty would have came into play. So let's go into a little bit more about Sheila. So here's how we explain the deductible phase for Part D. So up front, the drug deductible for 2025 is $590, but this is based on tiers. Most of the plans this year for tier 1 and 2 meds are waiving. That doesn't apply for those tier 1 and tier. That deductible comes into when you start getting into the other tiers, but it's based on the plan that you pick, and deductible payments count towards your max out of pocket. Tier 1, tier 2, think of your general blood pressure, cholesterol pills, and things like that. So initially, you'll pay your copays, your co-insurance based on the drug tier. You'll pay that on the plan until it totals $2,000 for the year. Once you hit $2,000, which you may have heard is considered catastrophic phase, Then you'll pay $0 for covered prescriptions for the rest of the year. If you have a standalone Part D premium, you still continue to pay that even after you've reached that 2000. So there's also a new thing that rolled out in 2025 called an M3P, which is a Medicare prescription payment plan, which allows you to break out those high drug costs into monthly installments instead of paying that all at once. So we will look at your drugs. If you have a really expensive one, we will take that total for the year, and it's automatically broken down into each month, and you would pay that separately. Part C, our Medicare Advantage plans. So Medicare Advantage is again a private insurance plan that combines Part A and B. It often includes extra benefits like vision, dental, and hearing coverage. So what calls folks to a Medicare Advantage plan is it's kind of a one-stop shop. It combines everything that you need all into one. It has extra benefits, a lot of the over-the-counter things, the fitness groups that you hear about, they're talking about these Advantage plan. This also locks you into an out-of-pocket max. So it gives you a ceiling on what you would have to spend for a whole year. The cost for these could be $0. It could be more depending on the carrier and depending on the plan. Co-pays, co-insurance, out-of-pocket maximums, those all apply. And this just brings it all together. You would still pay your Part B premium, and then in addition, you would pay nothing or something for your Part C. So just to break it up a little bit, let's talk about a couple of myths to see if they're myths or facts. First, is Medicare free? Now we know sometimes Part A is free, but Part B has a monthly premium and there's out-of-pocket costs. Myth number 2, does Medicare cover everything? That's definitely a myth. There are gaps in Medicare coverage like dental, vision, long-term care, but we'll talk about how we cover all those gaps. So this is when we're going to a little bit deeper. So we had Part A that we talked about, our hospitals. We've got Part B, our doctors. We had Part D, our prescription. Now we're deciding about the gaps. Do we want to fill the gap with a Medicare Advantage plan like we just talked about, or if we want to add in a supplement? So now we'll go into a little bit more of that. We'll start with, since we've already talked a little bit about the Medicare Advantage, we know how that works. Let's talk about the supplements. So meet Charles. He's a retired high school principal. Let's think about some things now that we've gotten this far, and Charles is 72 and he's thinking about Medicare. So Charles is enrolled in Medicare Parts A and B. He values the freedom to see any doctor that accepts Medicare nationwide and doesn't want the hassle of provider networks or referrals. So to be clear here, in Medigap supplements, there aren't any networks or referrals required. And he decided to add a Plan G to help with this out-of-pocket cost. So he chose Medigap because he travels between Texas and Florida to visit his kids and wants nationwide coverage. He takes comfort in knowing predictable, minimal out-of-pocket costs, and he doesn't want to worry about coinsurance or excess charges for hospital or doctor visits. So here in 2025, let's look at how a supplement will work. So our Part A, like we talked about, deductible is $1,632. If you had this Plan G, that would be covered here. Hospital coinsurance for days 61 to 90 is the $408 a day. That's covered here through Plan G. The 20% coinsurance, all covered by that Medigap. So Plan G does not cover the Part B deductible in 2025. That's $257. So this would be the only major out-of-pocket that Charles would expect to pay. So no drug coverage is included in supplements. So he added a standalone Part D. He enrolled during his Medigap open enrollment period, which was 6 months after enrolling in Part B, so he wouldn't get denied for pre-existing conditions. This works perfectly for individuals during that guaranteed enrollment if you've had health issues. Hello. Now let's go in. So this is one way to cover the gap. Medicare is going to take care of the 80%. Now we're talking about how we cover the gap for the 20%. Long-term care. So this is another one that Medicare does not cover custodial care or long-term care in nursing homes. It only covers medically necessary skilled nursing care. And that's for a limited time after a qualifying hospital stay. So I want to go over a couple of examples for long term when you think you would use it. This first one example, Mrs. Johnson is 78, lives alone, and has arthritis. A home health aide visits daily to help with bathing, light housekeeping, prep, and medication. She's able to keep her independence while still getting help. So a lot of times, of course, your health coverage is going to cover your surgery, your doctors, all of that is going to be great. But think about the recovery, how you recover from things. Um, Another one, let's think about if you know anyone who lives in assisted living facilities. So Mr. Taylor, 81, has mild memory loss, struggles with cooking and managing meds. He moves to an assisted living community where staff helps meals, laundry, and daily routines. So we could go into a lot of other different services. Just think about long-term care when you're not able to do your basic what's called ADLs. So those are like toileting, doing your medication, eating, bathing, cooking for yourself. Think about that. Medicare does not cover that. So if you had an episode or a life event that required any type of long-term care, we'll have to think about how we would cover and close that gap. Long-term care, not to be confused with home health care services, which sometimes Part A and Part B will cover some limited health services. Like if you need physical therapy at home, they'll come in and tell you to do your physical therapy activities. But if you needed like your medication, if you needed help getting dressed or clothing, that's not covered. So skilled nursing care is like let me see, go to my notes. Okay. So a little bit more about what Medicare doesn't cover. Routine dental care, dentures, and most vision care, hearing aids and exams. These are things that you'll see in Part C, the Advantage Plan, but they are all extra. So these are gaps that are really important to plan for because a lot of times this coverage was automatically included in your employer coverage, and that changes once you get to Medicare. So what you need to do for next steps, what you need to do enroll is first create an account on ssa.gov. If you're already collecting Social Security, you do not need to enroll into Medicare. You will automatically be enrolled into Medicare Part A and Part B with the option of not enrolling into Part B, like our example showed the individual that continued to work. If you're collecting Social Security disability, you're automatically enrolled into Medicare Part A and Part B effective the 25th month of receiving benefits. So step one is definitely make sure you have an account on ssa.gov, and then I can help you from there. Next important question, we talked a lot about penalties and when we can enroll. So at the age of 65, you are eligible 3 months before your birthday, the month of your 65th birthday, and then 3 months after. So you have 7 months for the initial enrollment period. All of this changes if you decide to keep working, but just think 7 months around my 65th birthday is when I really need to get Medicare taken care of. A lot of you might be here because you have a lot more time. If your birthday just so happens to be on the first day of the month, your Medicare enrollment period will begin 1 month earlier. So if your birthday was April 1st, essentially your Medicare could start March 1st because they don't want you to have any gap in your coverage. Really quick, true or false question. Medicare covers 100% of your healthcare costs. That is false. We've shown a lot of reasons as to why that is false. You can switch Medicare plans during annual enrollment period. Yes, you can. Now, there's a lot of things that we need to consider if you're thinking about switching plans during open enrollment, but you most certainly can do that. All right, so just to go over again what we covered today, we went over the 4 parts of Medicare: Part A, Part B, Part C, Part D. They're common myths, important timelines about when you need to sign up. Briefly talked about how to maximize your benefits and address those coverage gaps. We talked about what Medicare doesn't cover and how to plan for long-term care and home health services. And next steps really are that making sure you have that SSA account and book an appointment with me so we can start to see what's next. So we went over all of that. Just a few more things. In addition to helping with Medicare bill year insurance, we also offer cancer, heart attack coverage, dental, life insurance, final expense, more health insurance products, and long-term care. So if you need assistance or interested in any of that, please reach out. And if you learned anything today, enjoyed this presentation, please refer me. I'm committed to helping you understand. And that's all I have about Medicare today.